You've got the Northwest Showcase on 93.9 KPDQ, sponsored by Day Chiropractic. We're talking with Dr. David Day, and he's giving us some great information about chiropractic care and how it can help with things that we wouldn't even think that it can help with, things like allergies.
Yes.
I mean, I really didn't
No.
think, I mean, you wouldn't be the first thing I think of, chiropractic care. Go to Dr. Day for an allergy problem. And I think it's wonderful that you've helped people with that. If you'd like to call Dr. Day and ask him a question, feel free to do that. 503-786-9390 is our number here in the studio. That's 503-786-9390. You can also go to Dr. Day's website, daychiropractic.com. It's daychiropractic, all one word, .com, and some great information there too. And you can find his practice 3758 Southeast 122nd Avenue. Dr. Day, we've talked about allergies because a lot of people are suffering from that right now. So maybe they'll think, maybe I'll go see Dr. Day, and see if you can help. And you say you've helped people with allergies.
And it is exciting. But now please don't hear that I believe that chiropractic is a treatment for allergies, right? I think everybody with a nerve system would benefit from chiropractic care.
Okay, we're talking about getting the nerve pathways open and working.
So my philosophy, sometimes people think about chiropractic maybe not quite in the right way. I would like you to not think about chiropractic in the context of conditions. I would rather have you think about chiropractic in terms of your body.
Getting your whole system functioning well. Yeah.
Because a body that's functioning at 100% won't manifest, it won't have the heartburns, it won't need the blood pressure medication, it won't need these things. That when we have our body start to fall apart, then we go to the doctor and we've got too high blood pressure. The medical solution is to give you a pill that will artificially lower the blood pressure. I would think about this, well, what's wrong in your system? That your own sensors that sense what your blood pressure is, and then the brain has to interpret that properly, and then it sends the signals down so it sets the diameters properly, and so the blood pressure stays in a healthy state, right? So while chiropractic does lower blood pressure in people whose blood pressure is high, it's not a treatment of high blood pressure, right?
Okay.
That's we have to think about.
Okay, it's like you say, the whole person approach.
Yes.
You're looking at the whole body and how all the systems are functioning and working together, and you're trying to get that whole system healthy.
Yes, and so then you say, well, who would benefit from chiropractic? And I would say anybody with a nerve system.
Yeah.
You know what I'm saying?
All of us?
Everybody.
So
you don't need a reason to come into our office.
You're saying don't wait till you have all these symptoms and problems. Just start going to a chiropractor.
I would rather you never develop something like allergies, that you never develop something like high blood pressure, like you'll never take a pill for high blood pressure, that your cholesterol will stay healthy because your liver is formulating the right amount. The victory in chiropractic is all the things that never happen to patients if they take care of their bodies properly.
Okay. All right. So that's
better.
fair. Let's get everybody while they're healthy,
staying healthy. Yes.
Okay.
And then I have to help. My job also then is to inspire people, because what are the things that help us? Well, we need to be exercising regularly. We need to be eating properly. We need to maintain our lives with such balance between our spiritual and our physiological. We've got to keep the relationships in our lives healthy. So a whole person approach. And unfortunately, what I'm seeing in medicine is often the doctors will only let you tell them about one problem that you're having. If you happen to have two, you have to make another appointment to go over that second thing. Have you seen the sign
in a doctor's office?
It's driving me nuts.
Only talk about one problem. Make another appointment for anything additional.
What in heaven's name does that have to do with health?
I know.
Nothing. But they're really not help. They're really dealing with crises, and I'm grateful that we have the medical system for crises.
Yes.
But more importantly, I look at the vast number of people. We should all have a chiropractor, right? And we shouldn't have a chiropractor only when our body falls apart. We should go to a chiropractor to keep our system healthy, okay? So, but I do, and the reality is, many times what brings someone to my office is a crisis or something.
Okay.
That often is
But you can help them get back to good health in that way?
Yeah, and you were asking, we were talking on the break, and you guys didn't hear it, but we were talking a little bit about this because I had mentioned that man who came in the 3 times a week because he was having these terrible allergy problems. Well, he had been coming once a month for maintenance care. And most of the things were working just fantastic, but he had suffered some emotional losses and things like that over this past year. And I think his system got overwhelmed. The once a month at that point wasn't enough. Now, it was more emotional sorts of things that had happened to him.
But that can cause physical
I think that what happened
yeah.
was his adrenal gland then went into failure.
Yeah.
Or it started to not work the way it had for before. So when we essentially like gave him a booster shot, it's like let's give you enough adjustments that we can get through this, and then everything's I just saw him. He's down to once a week now, and he's breathing just fine. That it's like he has no allergies, right? You know, so if you've been having allergies, well, I lose 4 months of my year. It's like, stop it. That means your body falls apart. Let's keep that from happening.
Let's keep you healthy so you don't have to go through
And then you say, well, how often do you need to come in for maintenance? And it all depends on, I have a guy who lays carpet. He comes in once a week, and I would call it maintenance, although he's still trashing his body. I kind of wish he wasn't doing it, but for him, chiropractic lets him keep doing his career. Okay, you know, so I have other people who are once a week, once every 2 weeks, once every 3 weeks, once a month, once every couple months. So it kind of depends on what your life is like outside of the adjustments and how healthy your body is and what your, you know, how much degenerative arthritis and those sorts of things you have in
Would
your spine.
you say just even a little bit of chiropractic care will
Some,
help?
and something with more consistency is better than very sporadic and irregular ones.
Like
yeah.
once here.
Yes.
And
I
two
would
or three.
prefer classically in chiropractic maintenance somewhere in the about every 3 to 5 or 6 weeks, something like that, is a really good frequency for most people.
Well, now it would be a great time if you're a patient that hasn't been to Dr. Day yet, because you've got that special going on, $25, and that gets you started. Now that's going through May 15th?
15th of May.
And that starts tomorrow?
Starts tomorrow.
Okay, and what does that include? What is?
So it has everything from whatever, you know, I will do a full workup. You'll get your heart rate variability, that stress analysis, thermal imaging, surface EMG, posture. We'll actually do a bilateral weight. Now, I don't want to say this because nobody likes to have their stand on a scale. You know, some people, they don't even, they look at that thing and they say, if you make me get on this thing, I'm not going to be your patient. You know, they kind of don't, they don't want to go. But
Nobody wants to get on there
and I'll, look at me. I mean, I'm not as skinny as I want to be either. So, okay. But what we're looking for, you're actually going to stand on 2 scales, not just one. I could see, you know, we could see if, you know, if you're a little bit heavy, okay, you're a little heavy, fine, right? But what I'm interested in is your nerve system. And if I have you stand on 2 scales, if your brain is working right and your brain has interpreted, it will stand you so your weight is within 5 pounds left to right.
Okay.
If you stand on that and you're 30 pounds off,
so
something's wrong with your brain.
Really?
Your brain isn't integrating properly because you think, oh, because my posture is off. No, think about this. Maybe your posture is off because why is your brain letting your posture be off? What's wrong? There's something wrong. Because and it gives me one more metric to measure, right? Your bilateral weight core, how close are you to how you're supposed to be? Healthy view within 5 pounds. So if you're off, even if it's 10 pounds or 15 pounds off, why is it off that far? It shouldn't be off that far. That tells me your system isn't in tight enough calibration.
Okay.
And so it's just one more thing, and that's one more thing that we'll be able to see that improve as you get better.
So these are all things that give you clues as to what's going
on
with the
You
person.
have no idea if your bilateral weight scale is off. The only way to do this is to do it, and it's so simple. 2 scales, right?
Yeah.
We could do this at home, but someone else would have to look while we're doing it. So if you want to try something crazy, you get 2 bathroom scales. You stand on them in your own bathroom and have one of your kids or somebody, your wife or somebody, look at that and see if you're standing if it's within 5 pounds or not. If it's not,
it's off, then you've got something wrong there.
Yeah.
Wow. Okay. All right.
Now, the crazy thing is every once in a while, if you have a scoliosis or if you have something like that, your brain may be able to bring it back, but your spine is still crooked.
Yeah.
So you would still benefit from some chiropractic care. It's kind of an it's just, you have to, just like anything you measure, you can't assume that if it's in this, that everything's 2 thumbs up, there's nothing else wrong. No, it's just that one, your brain has brought you to balance, but in the process, do you have a scoliosis or do you have something else? And if the x-ray shows that, we still have to address it. You understand? That's why you can't just, you know, these are all part of things. So, we'll take whatever x-rays we need of your spine. I've even taken pictures of shoulders and whatever. So I don't care. You know, if you come in to see me and you are genuine and you want me to take a look at your body, I will take a look at your body. I don't care. If I need to take a picture of your hand because you've had a problem with your hand, I'll do it. Right? It doesn't matter to me. The bigger issue is, would you benefit from chiropractic care?
And for $25, you can find out a lot
absolutely.
by coming to see Dr. Day. And
Yes.
3758 Southeast 122nd Avenue is where he's located, just south of Powell there in Portland. And if you'd like to call, 503-760-7572. That's 503-760-7572. $25 gets you started in the process, and that's a great deal to get people interested in chiropractic because they get a lot for that $25. And that's going on through to starting tomorrow through May 15th that you're offering that special. So great time to take advantage of that.
So the next thing here is a concussion patient.
Okay. we're hearing a lot about concussions nowadays
certainly
with,
are.
with football players and
Yes.
all kinds of things. And I remember my daughter, when she was young, she got pushed over by a little boy on the playground. And, I started driving her home. She wasn't making sense, and I drove her straight back to the doctor. And I come to find out she'd had a concussion. I mean, it happens a lot.
Yes. Now the question is, what do we do about it?
Okay.
Okay. Now, what they often do is they will diagnose the concussion, and then they will have you watch your.
That's
watch your
that's
kid.
all that they told me to do is
Okay.
just watch her.
So here's a story. This is about brain function and symptomatic improvement in a concussion patient after correction of vertebral subluxation. So if you take a kid who sustains a concussion, what are chiropractors going to do? We're going to think about what just happened to the kid. Oh, she fell and she hit her head then on this thing. Okay, well, almost always the medical doctors think about where the head hit because they're going to look for a subdural hematoma.
Sure.
They're going to look for
which
a
is
bleed in the
important
brain,
to look
right?
for, yeah.
Absolutely.
Yeah.
But let's assume that that's not. So let's say you were in the emergency room. They may have run a CAT scan, or they may not have. Whatever. Or they might have looked and said, "Okay, we don't see any." Check the eyes. Okay, there probably isn't a hematoma there. Then they'll have you watch. Well, chiropractors say, "Wait a minute here. If it was bad enough to bang up the head, what if it dislodged some of the alignment of the neck?" You see,
Okay,
the
that's
medical
where you
doctor,
come
that's
in.
where I come in, and
Okay.
this is where, and the medical doctors don't really look at that. They'll do a quick assessment. Follow do your eyes track? Stick out your tongue and do
Yeah.
do the things to make sure the brain is functioning within the normal parameters, and then you have to go home and rest and let the brain heal. Essentially, that's kind of the way the medical doctors do it. But this talks about somebody. This was a kid. She was 15 years old. And she had been hit in the head with a falling van door. So a door that was closing and her head was...
Oh, no.
Okay,
Oh.
so she was taken to the hospital where she was diagnosed with a concussion. Since the injury, she had been experiencing constant pain in the back of her skull, headaches, and had difficulty concentrating. So parents, if you have a child who is having trouble in school and they're complaining of headaches, and then you have their eyes checked and you get glasses and all these sorts of things, but the kid is still having trouble concentrating, think about this study. Because what they found is this little girl had some misalignments in her neck, and then we'll get to hear what she did. She before this thing, she had participated in hockey at the high school level. Okay, so this was an athlete. Now, she hadn't been injured on the hockey field. She'd been injured by the
van
door
door.
closing her. Okay, but she had been given a pre-impact. Yeah, she had been given a test, and we might talk about this in a little bit, but I think we do need to.
Yeah, we do need to take a break, and I want to hear more about this girl
we'll
and how
continue.
chiropractic can help somebody that's had a concussion.
Yeah.
We're talking with Dr. David Day of Day Chiropractic. That's Day Chiropractic. It's 3758 Southeast 122nd Avenue, just south of Powell. 503-760-7572 is the number to call for an appointment. DayChiropractic.com is the website. And we're talking about how chiropractic care can help in a lot of situations where you may not have thought about that. We'll be back to talk with Dr. Day in a moment to the Northwest Showcase on 93.9 KPDQ.